All through college, medical school, and even when I was doing my residency, I worked on research in molecular biology and molecular genetics. One of the most important parts in our bodies, and particularly in our blood vessels, is that inner lining of blood vessels called the endothelium. And there's a lot of work in trying to figure out how that inner lining or the endothelium reacts to injury. So my work really entailed trying to figure out the biological process of how that happens, and also figuring out ways of how to manipulate that process and make it better. There's a gene that we studied during medical school that codes for a protein which is found in the cell membrane of cells, and it regulates how chloride and bicarbonate are exchanged. And one of the research that we did was to figure out if a defect in that protein sort of was one of the causes of high blood pressure. And we determined that it's involved, but it's not the only cause of high blood pressure. You know, I wish we knew the answer. A lot of it is genetic. What we know, however, is that patients that come from families where there is heart disease, those patients have to be more vigilant about controlling all the other risk factors. So for example, patients that come from families where their mother or their father had a condition, particularly a heart attack or some of the other cardiovascular conditions, if they smoke, if they don't control any of the other risk factors, they're very likely to have a heart attack or have other medical problems. There are some really exciting aspects of cardiovascular surgery. And two of the most exciting aspects are, one, that we're developing techniques where we're learning to do the same surgeries in a more gentle way, meaning through minimally invasive approaches. So for example, right now, there are ways for us to replace the aortic valve without even making an incision in the chest, meaning through the groin or through other incisions in the body. And the second one is that we have found ways where surgeons can work together with other specialists in the medical field and work together to solve the same problems. So that there's not this competition between cardiologists, for example, and surgeons, but now we can work together as a heart team and come up with more innovative solutions to some of the cardiac problems that we had in the past. In fact, at Southside Hospital, which is part of the Northwell system, we have an excellent team of cardiologists, vascular surgeons, and cardiac surgeons that work together to come up with solutions to these problems. The name of the show is El Show del Doctor Fernández, Su Salud en Español. So it's a show which is basically designed to inform patients in Spanish about some of the cardiovascular risk factors and about their own heart health. In the Latin community, right now there's a lot of information about different products and different things that are not scientifically proven and that are not clinically accurate. So one of the things I try to do is to inform patients in a scientific way, in a medical way, and in a way where they get informed and where they learn to also participate in their own health. It's mostly for the patients that I see in my office. Also, I do a lot of outreach to different sort of civic organizations, different groups, sometimes churches. And when I do go to those places, I tell them about these videos. And some of the videos come from questions that I get asked when I do these events and when I do this community, group. Yes, they do. And two of the main problems are that there's a high incidence of cardiovascular disease, because a lot of times some of the medical risk factors for cardiovascular disease are not well controlled. And the most common are obesity, diabetes, and high blood pressure. And I think because the control of those risk factors is very poorly controlled, a lot of patients develop cardiovascular disease, and they end up having a lot of other problems related to that. And the second one is that I think that a lot of times in the Hispanic and Latin community, patients a lot of times do not participate in their health care, so they don't a lot of times they feel uncomfortable asking their physicians some of the questions that they should be asking and really being active participants in their health care. One of the reasons I wrote the book, Undocumented, was to sort of reach out to people and really show that the people that are here, those 15 million undocumented immigrants, are here just to be part of the American system, the American way of life, and they're here to contribute. They're not here to steal jobs or to break the law, these are people that love this country, in a lot of times even more than we do, because they came here for education, for opportunity, and to be part of the American way of life.